So we're going to move into the last phase of our discussion here. Dr. Ledden has to catch a flight, so I'm going to take over being the MC, and I'll introduce, it's a panel discussion to talk about the food manufacturers and their role and relative to your role, and it's appropriate that I do this because I'm from Alberta and we're dealing with the tainted beef there, so it's appropriate time to discuss this. And I'm going to introduce our leader for today, Dr. Richard Hunt. He was the founder and president of the Canadian Digestive Health Foundation, and he's going to lead really an illustrious panel to talk about this topic. So Richard, welcome up on stage.
Thank you very much, Richard, and good evening, everybody. If I could ask the panelists to come up, and for the sake of time, while they're coming up to join us, I'll introduce them. We have Leah Gramlich, who you've already heard from today. We've got Dr. David Armstrong, who is a professor of medicine at McMaster in Hamilton. To my left is Pierrette Bouclis, who's a registered dietitian and currently the Senior Manager Health and Nutrition at General Mills Canada. Next to David Armstrong, we have Gabrielle Bauer, who is a well-known medical writer who is familiar with and interacts with the media, with foundations such as the Canadian Digestive Health Foundation and physicians and patient organizations. Professor Kush Jijiboy, who you've already heard from. Dr. David Jenkins, who's a professor of medicine here in Toronto and a distinguished nutritionist who's been working for many years on appropriate diets to help control hyperlipidemia and diabetes. And then last but by no means least is Sandra Saville, who's a registered dietitian. She's been a food nutrition expert for a number of years, working both in the clinical setting, in community settings, and providing extensive consultation both to individuals, but also particularly to the food industry and to some of the large stores that market foods. So I think this, you'll agree, this is a great panel to address this topic of the responsibility of companies and manufacturers of foods and nutritional supplements, and also the role of healthcare providers as patient advisors with respect to nutrition. And of course, we've got many challenges. Yesterday was World Food Day. And of course, one of the things that was particularly promoted was the rising cost of food and the huge challenge that's being created by the diversion, particularly of corn, for energy. And this is just one of those issues in the background as we face potential global stressors in terms of food and food production and the cost of food, as we've already heard. The cost of food for First Nations here in Canada is obviously a big challenge. So that by way of introduction, I'm going to ask Professor Kush Jijiboy to make a few comments in relation to how the sort of studies that we've been discussing here today are implemented and important within the context of the choice of nutritional approaches. For example, in the management of disease, in the potential prevention of disease in the community setting, and of course the whole question of what kind of evidence we would need to make major changes at the level of childhood and schooling, which has also been raised during the discussions today. So, Kush.
Well, thank you. When we talk about nutrients, the evidence that we are trying to look for is really at three levels and at three degrees of strength. First of all, there's the claims. I mean, in this case, we are talking about claims. And if we talk about a nutrient claim, the one claim is whether it corrects deficiencies. And that is a very simple type of claim, because if you've got, say, a vitamin and you give it to a person who's vitamin deficient, it's pretty obvious that the vitamin will work. However, it's very, very important that the product that is provided has exactly what it says it has, and that we know its excipients, in other words, what are the additives to it, because very often these additives can have side effects which are unpredictable. I think that these are issues that have to be dealt with. The second level of claim that talks about is what's called structure and function claims. That is, somebody says, okay, you're going to eat a particular product, say something like coenzyme Q10 or carnitine, and they're going to get muscle strength. Well, that is a sort of a structure and function claim. And there, the level of evidence tends to be a little bit more stringent. The question is, how do you decide whether the person's muscle strength is better? The best way of dealing with any kind of claim which is in a sense evaluable is by randomized trials. And but however, there are certain intuitive things. For example, it's been recognized, for example, that if you take a higher protein intake in a developing child, that the higher protein intake is desirable based upon evidence of growth factors, etc. So in those cases, the evidence is more strong. Then you come to the third group of claims, and that is disease claims, whether you're going to prevent or treat disease. And that's where things become very tricky, because very often the relationship between structure and function and disease sort of tends to become a little bit nebulous. When you start to say it prevents heart disease, well, what kind of heart disease? Is it because the cardiac function is improved, or is it because you have avoided coronary artery disease? And so there the claims have to be much more well defined. Finally, you come to areas where, and there I think you do need randomized trials to be able to substantiate it, or certainly strong scientific evidence that it does work, because you're then talking about the nutrient acting like a drug. And then finally, the area is so-called prevention. And prevention becomes extremely nebulous. I mean, like green tea as an antioxidant, or taking omega-3 fatty acids and the anti-inflammatory. And there are some areas which are quite strong and some areas which are not as strong. And the ability, those are called qualified claims. And I think it's important to recognize that. And finally, there are a number of nutrients on the market, which I find, I mean, patients bring them to me, they're so varied. For example, particularly probiotics. And with probiotics, nobody knows whether the bugs are alive or dead, and how much actually exists in the preparation, and what those bacteria are. In fact, the ability to standardize that is extremely difficult, because the technology is very, very difficult. And so under those conditions, we have to be sure that what is being sold is in fact what we think it is. And I find patients come to me with all kinds of combinations and tablets saying, I'm taking an antioxidant, I'm taking a probiotic, I'm doing this. And we have a plethora of manufacturers in Canada with all kinds of different combinations, some of which I understand and some of which I don't. And I think we have a problem which really needs to be addressed there.
Thank you, Kush. So, Sandra, how do you see this sort of difference in levels of evidence being translated into the practice of the dietitian, or for that matter, any other healthcare provider, and particularly in the community setting?
Well, as a dietitian, first I have to say thank you very much for the invitation to participate on this panel and for the event today. in terms of the evidence of practice as a dietitian, and I speak for my colleagues, we come with over 4 years of a university degree and then having at least a year of training before becoming part of the Regulated Health Professions Act. So as far as dietitians, we have some specific training, and I think this is important when we're dealing with information for the consumer, because that information can be very different depending on who is providing that information. My name tag today said nutritionist. However, anybody can have stake to that claim, no educational background. So certainly knowing who we are connecting with and linking is important. Now, in terms of today, I was actually given 3 questions, and I think to follow through with my few minutes, I would love to approach and tackle these 3 questions. And the first is, in terms of all foods having some degree of biologic and pharmacological activity, as we learn more about foodstuffs, and certainly nutrition is an evolving field, the societal responsibilities become increasingly of concern for the regulators, especially with respect to obesity, heart disease, diabetes, etc. That in mind, who should we consider to be the guardians of good health when it comes to diet? Individuals, government, or both? Great question. I look at it as far as the individuals are the endpoint users. These are the people who are consuming the food, and the onus needs to be placed onto consumers with respect to their food choices. That said, however, consumers also need support, and that support coming from different choices, certainly in terms of health providers. Absolutely, each and every one of us should be supporting the consumers to be making very wise, nutritious food choices. Now, there is a recent research article released from Conference Board of Canada, May 2012. Some of you may be aware of the article, and it's titled Improving Health Outcomes, the Role of Food in Addressing Chronic Diseases, certainly fitting for today. That research actually indicated that the consumers believe that both government and industry can help them to manage their dietary risk, which is interesting. They want government to provide them with the information about both diet, nutrition, and disease, as well to assist the patients in making dietary changes, but at the same time to stimulate the food industry to continue to develop and to refine products for the best of health. Now, the second question, in terms of marketing of foodstuffs, particularly the convenience foods, the food industry is often considered to push their products by enhancing what is called mouthfeel. And although there have been improvements in reducing salt content and so forth, we do have a long way to go. The question being, what issues should we be tackling, and according to what priority? As a dietitian who likes to base my recommendations on science, and certainly best practices as well too, let's look at what has provided the most convincing evidence. And with respect to chronic diseases, those being cancer, certain types of cancers, heart disease, diabetes, what are the food substances, or at the same time the eating patterns that can increase the risk of disease? We know the convincing evidence stands with certain types of fat, saturated trans fats, in addition to sugars, as well as looking at the reduced intake of sodium, alcohol, and then that whole aspect that has already been covered of obesity. Now, not to forget that at the same time, increased consumption of particular substances known to reduce the risk of some of these chronic diseases, both fruits and vegetables, and as well, speaking at a digestive talk, fiber. So in terms of fruits and vegetables, one interesting tip I love to share, be it dinner parties, on the subway, wherever, is that a recent study of over 300,000 individuals, and what they found is that there was a reduced, by consuming that one extra serving of fruits or vegetables per day, there was a reduced risk of dying of heart disease by 4%. And that I see as powerful medicine. So Hippocrates was right, let food be thy medicine. And in terms of emphasizing that we know has some very strong science behind it. The third question, the best way to move forward, both on consensus and public education around these issues, I think the number one is looking at certainly if we could insert Dr. Hutchinson's presentation right here, I would be totally happy. But at the same time, I think it's best to engage all of the stakeholders together. And this is something that actually already took place. So this is, I think, dovetailing. We need to dovetail with what is happening within the population. Back last February, the Conference Board of Canada actually hosted the first Canadian Food Summit. Will be held again in 2014. As a nonpartisan organization, the intent to develop a food strategy for Canada, not just based on health and disease, but certainly looking at industry, those who are producing food, to come up with a strategy that will provide for Canada certainly a vision for the future of our food. And I think important for us to dovetail here. Now, the Centre for Food in Canada has been developed, and with that food strategy, I think important for all of us to provide our messages and to provide input as well too. Where we need to be is working together to provide individuals with nutritious food choices for the best of their health. Thank you.
All right, thank you, Sandra. So David Jenkins, both Kush and Sandra have raised a number of issues that I think relate to some of your concerns, that in order to be able to put into effect some of the things that Sandra has touched on, you need an industry which is able to move forward and to be able to take a positive approach to addressing some of these questions. So would you like to enlarge a bit more on the restraints that there may be on the industry and how we might be able to gain from looking at that more seriously?
Yes, thank you. I'm on. Yes, thank you, Richard. I think that industry contains people of goodwill, just as you find anywhere else. And I think what these people of goodwill need is encouragement, because they too are responsible for shareholders. So I think that one of the things that I would like to see the government doing, and they're beginning to do it now, but we've waited for about 30 years for this to happen, is enabling legislation. In other words, legislation that enables the correct regulation of health claims, based, as Kush said, on randomized controlled trials. But when these things are undertaken, when industry steps up to the plate and does what the pharmaceutical industry has done and actually put things to the test, that they should be able to talk about it in a reasonable, intelligent fashion, intelligible, importantly, on the label. I think if you go through the supermarket today, you see a sea of colors with all sorts of exclamation marks and all sorts of statements that have very little to do with health, or if they do, are obscure. It's a shame that if the pharmacy looked like that, then we certainly wouldn't be writing prescriptions. So I think that to let the public get their tertiary nutrition education, and they need tertiary nutrition education, we need to make the supermarkets and the food outlets the vehicles for this education. And we need, I think, to have a concerted plan to make this happen. One of them is to allow, one of the pieces of this platform that I would see is to allow industries that have done something useful to talk about it.
And could you go a bit further in the sense that Kush has addressed the issues of levels of evidence, and we have levels of evidence that relate to some foods for which the claims have never been approved by government? Do you see ways in which we can move that forward? Is it that the industry is all being treated with one approach, that this is really looking at all aspects of food and food supplements, and therefore it's always going to be difficult to get a claim? Or how do you see us being able to get claims for those foods that really deserve it?
I think that it should be relatively simple based on some reasonable clinical trial evidence for a health claim to be made. And I'm talking about reason. I think that the scientific community, physicians, should be on the panel, not just government people who make these decisions. They should be the ones who help with the regulation of this. If I just say that the sort of example that we deal with, plant sterols block cholesterol absorption. They can be put into margarines and they can help to lower cholesterol in patients. These margarines were sold around the world for 7 years before Health Canada finally have allowed these. Having said that, to show just how protective Health Canada feel they have to be, they actually had a website when the first margarine was put out unofficially in Canada to test the waters. A website went up saying, if you have consumed this product, you may wish to go and consult your physician. It is not suitable for children, pregnant women, people with high cholesterol levels. There was not any real evidence apart from some rat studies which are dubious in spontaneously stroke-prone hypertensive rats who were not the right model for doing any study of this sort. And it just showed, I think it showed the rest of us in the sort of medical nutrition community what one was up against. One was up against a bureaucracy full of well-meaning people, but where change was very difficult.
So, Pierrette, you're the sole representative of the industry here. You've heard a number of points that suggest that perhaps you could do better in terms of being able to actually register claims. But of course, there's the issue of who do you actually react to. There's the marketing issue, but there's also the public search and expectation for healthy foods. So could you give us some perspective on both of those issues?
Absolutely. Is my microphone on? Yes. Okay. And I appreciate all the discussion that's gone on so far, and I appreciate the fact that I am sitting here as the lone representative of the food industry. I love the comment that David just made about the food industry being filled with well-meaning people, because in fact, as a health professional moving into the food industry a few years back, I was given the evil eye by a few of my colleagues about moving into that sort of evil zone. And in fairness, I think what I discovered in going to that environment was there is more similarity than difference between our practice as health professionals and the way that the food industry approaches the development of their products. They're just taking it from a different paradigm, and I'll get to that in a second. But frankly, if we think of ourselves as client-centered and we think of ourselves as responding to the needs of our clients, that is exactly the way that the food companies approach the development and marketing of their products. They're looking to understand what their consumers want, and with that information, making a case about why what they're providing hits that mark. It then becomes a personal decision on the part of the consumer to choose it or not. One of the things they started hearing through the wealth of consumer research that they were pulling in to make these decisions was that health was of growing importance to Canadians. The average Canadian had a lot more access to information from a variety of sources, some great like Health Canada, some maybe more questionable. And they were asking a lot more questions about our products through our consumer information lines, for example. As a result of that, the food industry figured out that some of the bigger companies, and some are represented here, maybe we don't have the skills in-house to be able to deal with those issues. And so people like myself began to be hired in or consulted with, like Sandra, to make sure that they were informed about what is the evidence that we should be working with in this area. How far can we go? What should our products maybe look like? And those are some of the questions that are being asked of myself and my colleagues right now in those food companies. Because much as I do agree, there is a personal responsibility for your own health. You're never making those decisions outside of the environment in which you're living. I come from a population health background, so this is all very familiar to me. And frankly, I do feel that we have a responsibility as a food company to make sure not only that we present things that we know can help people, maybe that's an opportunity through a new claim, that we can work with researchers to evaluate properly with appropriate evidence, to work with Health Canada to present that evidence and talk about how it might benefit Canadians. But also, we have a responsibility to make sure that our products measure up on the basics, some of those things like trans fat and sodium that have already been discussed. And that's the kind of partnership that I think I'd like to see us be better at, all of us in this room, to recognize that we have a great body of knowledge, each of us individually, but there's so much more to learn on the other side of the fence. And it's important for us to open those dialogues and share that information so that good decisions can be made, both in a client sense, when you have those questions come to you, and in my case, where I'm trying to make sure I have all the facts to present to the people who are going to be plotting the next development process for a product. It takes a while to come up with these things, so they want to make sure they're putting their efforts where they're going to work the best, serve the consumer need, and make a real difference for people.
Do you see particular ways in which you can promote that dialogue, or are you as a company already embarking on that?
I think we do our bit. I think there's always room for improvement. And certainly big companies like General Mills, and I know Kellogg is represented in the room, and Danone and so forth, we are engaged in that whole set of background, the discussions with organizations like the Digestive Health Foundation, with Health Canada, with the researchers to understand where things need to go. There's always room for improvement, and I think we should be holding ourselves against that higher standard.
Well, thank you. Leah, how about your view as a clinical nutritionist with extensive experience, academic research, the whole issue of how the promotion of good health through nutrition should be promoted? How do you see this sort of evolving background of this discussion in terms of where the industry is and where the responsibilities lie with industry, with government, and with us as clinicians?
We're all responsible for our own behaviors. We need a supportive environment in which to be able to undertake those health-seeking behaviors. And I think that nutrition messaging is extremely complex. There's a lot of mixed messages and confused messages. There's a lot of information. There's marketing strategies. But the medical and scientific community is not without a few blemishes. So, for instance, it was Kush who described the thinking relative to nutrition knowledge from the clinical perspective. That's hospital-based nutrition, malnutrition in hospitalized patients, using glutamine in critically ill patients. The level of data that informs that kind of knowledge should come from high-quality, prospective randomized controlled trials or meta-analyses of high-quality information, and that information needs to be vetted by an informed health professional, whether it's a dietitian or a physician. At that public population health interface where the person's buying food from a retailer, whether it's at a restaurant or a grocery store that might have appropriate messaging strategies, the level of health information, research, and how we interpret that is different. I actually think that agri-food and the food systems have been really proactive in trying to provide health messaging and products that meet the consumer needs. There's a market force that's driving that as people try to segue and make more healthful choices. On the other hand, I actually think that the health community, the healthcare community, has not been quick to adopt nutrition and activity strategies to promote health and to prevent and treat disease. We need to show leadership. Unfortunately, dietitians are the health professionals in our communities that have the 4-year undergrad degree plus postgraduate training to allow them to be able to provide consistent evidence-based messages. In Alberta, there's 100,000 healthcare employees, there's 400 dietitians. So they train the trainers or they work with specific populations such as diabetics. physicians are typically leaders in healthcare systems, and we know that there's a huge knowledge gap amongst physicians. And so I like what Hassan says. I think that Health Canada is doing what they can. They're trying to be more responsive to regulatory challenges and trying to step up to the plate and the bar that David has set. On the other hand, I think our health systems could be doing a better job, and that physicians working in conjunction with the experts, dietitians, need to show more leadership so that patients know where to get creditable information, so that when they go to that interface where they're acquiring food, they can make more healthful choices.
Thank you. David, as a healthcare provider with an interest in nutrition, somebody who's worked closely with the industry, particularly the pharmaceutical industry over the years, how do you see this in terms of pulling together some of the things we've heard and where we should be trying to move forward?
Thank you. The simple answer is I see this as complex. I think there are a couple of areas that I want to address which build on some of the other points that are made. I think if I build or look at what Leah has just talked about in terms of healthcare professionals, one of the views I had on this actually goes back to a model that was developed for specialist physicians by the Royal College of Physicians and Surgeons of Canada. And I say that not because this is a physician-centric model, but they talked about the responsibilities of physicians and specialist physicians in what they call the CanMeds roles. And we tend to think of ourselves as physicians or as professionals. As professionals, we see patients, we make a diagnosis, we treat, we do something which is specifically sort of treatment related. But there are many other areas that are actually part of our role, and I would argue part of everybody's role as a health professional, particularly in nutrition, where I think our nutrition management in healthcare really is much more like the sort of medical care industry of 100 years ago. That is, we're ossified. We don't really have a knowledge. There's a knowledge gap, as Leah said. And I think what we need to bring on board are the notions not just of being professionals, but being communicators to talk to our patients and explain information. We need to collaborate with other groups of professionals so that we can deliver the appropriate information, not just to patients, but also to companies, work with companies and work with government and work with regulators so that everybody appreciates the breadth of the information. We need to do that as scholars. We need to do that as managers so that appropriate information is given and advice is given to patients. And we need to be health advocates. And I think we need to look at this much more broadly when we look at nutrition. And one of the challenges, I think, is, as Richard said, I've worked with the pharmaceutical industry, and there's an element of the model that will translate through into healthcare because of the health benefits and some of the detriments associated with nutrition. But it's actually somewhat different because it's actually also part of consumerism. And, you know, although there's regulation around the automotive industry and various other industries, government doesn't regulate what cars are actually made. They provide guidance, they provide a framework, they say what has to be done, they say what's safe, but they don't say you must buy this car, or this car cannot be bought, or this car cannot make these sort of general recommendations. So I think that we need to work out what is applicable to healthcare and what's applicable to nutrition. And then the other area that I just wanted to comment on really comes down to evidence, because the problem is nutrition is so complex that the evidence that could be accrued is infinite. We're never going to be in a position to make recommendations that are evidence-based, strong evidence-based about everything. And so like in many consensus conferences, we need to be able to say where there's evidence and to apply that appropriately, which we've heard doesn't always happen. But then the other thing is to say where there is a knowledge gap, is to say specifically, we do not know here, and this is a broad recommendation that there is no evidence to support anything here, and leave that as an area where you don't have spurious recommendations come to fill a void that has been left because we've abrogated our responsibility to make a recommendation. So just to summarize that, I think there's a huge amount that we can do as health care professionals for our patients, and also in working in collaboration with industry, with regulators, with Health Canada, with government, to provide a framework which will allow us then to deliver appropriate health care.
I think you've raised a number of important points here. I mean, you are really highlighting how important it is that we work in a multidimensional way. that we have to work as a team, and that team may start at the level of Health Canada and goes right down to the primary care physician giving advice. And it seems to me that the way that medicine has been going in the last couple of decades is that teams have tended to be broken up, and they've been broken up because they were perceived as too expensive. We still probably manage teams within high-intensity surgical areas like heart transplantation and so on. But the fact of the matter is that in gastroenterology, we do not often spend time talking to the registered dietitians, and they don't necessarily talk to us. So that it's somebody who's a consultant gastroenterologist, as 4 people are on this panel, trying to educate primary care physicians without having an integrated registered dietitian as part of that whole process isn't going to achieve a very good result, it seems to me. And this is where I think the management in healthcare has gone in the wrong direction. Money saved in one place is leading to big cost in another. And if we're really going to address issues such as the fact that half of our population is certainly has an excessive BMI, if not is truly obese, and many of the other issues that were highlighted, like cardiovascular disease, diabetes, and so on, is going to require a very well-structured team approach. So how do we promulgate some of that, Gabrielle, in terms of the media, the writing, and the communications?
Well, being a writer, I wrote something down, so I'm going to start with that. Well, obviously, I see it as a shared responsibility. Starting with the companies that manufacture and sell food have a dual responsibility to remain profitable so they can continue to exist and employ people and to provide foods that keep the public healthy. The trouble is, sometimes these parallel responsibilities can work against each other. High-quality, healthy foods typically cost more to produce, and it is all too easy to create inexpensive, highly palatable foods with low nutritional value. So what's a manufacturer to do? For my part, I think it's unrealistic to expect manufacturers to set aside their bottom-line concerns entirely in the interest of public health. It's a nice idea, but it's not going to happen in the context of our corporate system. For this reason, I believe consumers must be the major driving force behind the quality of our food products. When public demand for healthy foods rises, companies will respond and have responded to the demand. We've seen this happen, for instance, with peanut-free products. It's very costly for manufacturers to set up peanut-free facilities, but several companies have risen to the challenge. The public has also insisted on low-fat dairy products, and companies have responded with an unprecedented variety of milk, yogurt, and cheese products. Which raises the next question, which is what drives the public, us, to demand healthier food choices? And the answer, I believe, is education. That's where health professionals and health journalists like myself come in. It is our responsibility to help the public sort the informational wheat from the chaff, and there's a lot of chaff going around these days. As has been said, there's a lot of information, and there is even more misinformation. The popular media keep telling us about the near magic qualities of specific foods, from pomegranates to acai berries, and the malevolent properties of other foods, dairy fat one year, corn syrup the next. People disenchanted with mainstream medicine yearn to believe that this nutraceutical supplement or that alternative therapy will cure the diseases that ail them. As Ben Goldacre says in his must-read, as far as I'm concerned, book, Bad Science, instructions like eat your greens or control your portions don't have the sex appeal of the magic food claims. The public thirsts for magic, which the media are only too happy to deliver. And I encounter this in my profession a lot, where I am asked to write about antioxidants that cure this or foods that boost the immune system, and there might be scant, if any, evidence to support these claims, which creates conflict of interest for me because I'm supposed to go looking for these things, and yet the evidence is not enough to justify writing these articles. So the health profession's primary responsibility, in my view, is to temper the wild claims with the sober logic of evidence, as so many of us have been saying, to educate consumers to view all extreme claims with skepticism, and to impart the principles of nutritional common sense. When an educated public understands good nutrition and insists on getting it, manufacturers will supply it, as they have already begun to do. So that's the grassroots part of the equation, from the bottom up. The other part comes from the top down, and that is from government. And I do believe that government has a prescriptive role in this arena. Here's a quote from a 2010 article in The Atlantic magazine. Appeals to corporate social responsibility are not an effective way to strike a balance between profits and the public good, and they may be a distraction from more effective initiatives such as government regulation. I believe Health Canada can and should be far more assertive and innovative in their food policies. Several other countries have taken nationwide measures to reduce salt intake, such as Japan, Finland, and now the United Kingdom. The UK's program requires manufacturers to decrease the salt content in processed foods incrementally to acclimatize the public to a lower salt content. In 2004, Denmark became the first country in the world to ban trans fats, and experts say the ban has helped reduce rates of cardiovascular disease by over 30%. And last year, the same country implemented the world's first fat tax on foods with more than 2.3% saturated fats. Why can our federal and provincial governments not implement more policies of this kind? They can, and I believe they should. And when they do, I believe food manufacturers and distributors have a responsibility to accept all reasonable requests. Government, in turn, has a responsibility to support industry through such transitions. So, in short, I see nutritional quality as a shared responsibility with government, industry, health providers, media, and consumers playing complementary roles. As a society, our highest aim should be to create conditions whereby economic concerns align with improvements in nutrition. And that's the best scenario we can hope for.
Thank you, Gabrielle. I'm aware that we're a few minutes over time. How long do we have, Richard? Okay. 1 minute each. It'll be 7 minutes, actually. I'm going to give them 1 minute each just for an additional comment. And we'll start with you, Kush. Any additional comment that you'd like to make? Literally half to 1 minute.
Well, there's also the issue of the person who advises about food and nutrition. And I think there are a few things that I've learned. One of them is that people who give advice must have a knowledge of the science behind nutrition. I think one of the problems is that there's a lot of misinformation put by individuals who become, quotes, nutritionists rather than
so better education of healthcare providers.
Right. Yes, that's what I think is important.
Thank you. Sandra?
Thank you. I think my key message, if we have been motivated in terms of any of the messages we received today, move forward with them. Certainly stepping forward to the plate with the education that we have so that we can impact a positive health benefit, be it for one individual, let's hope for far more, let's hope for all of Canada. Thank you.
David?
Thank you. I still want to say that I think industry is full of good people, and I'm with a conflict of interest. I will declare my interest in Loblaws and the Blue Menu that I've worked with them to develop. I think they've done that at some expense to themselves, although I think it's been profitable afterwards. But again, they can only go further if we have government regulations to help them.
Thank you.
Yeah, I guess I come back to the idea that we, as health professionals, should be considering ourselves open-minded enough to continue to learn and look for the evidence and to be collaborative and to work together to find the right solutions. And if you can put those two things together, staying open-minded and having very interesting conversations with people you might not have collaborated with before, can turn up some really innovative solutions.
I think we're at the tipping point. There's interest in nutrition and health improvement, and through collaboration with all the partners that we've defined, that's how we're going to achieve it. It's the experts in this room that need to push us over the edge.
Thank you. David?
I'm bereft of comments. A I was thinking about it from a healthcare point of view. I think one of the huge challenges, talking also about education for healthcare professionals in nutrition, is actually that the system doesn't value nutrition. That the healthcare environment, and in fact the consumer environment, really doesn't set aside either the resources or the space to say that nutrition is an important part of what we do. And without that, it's going to be very difficult to implement this on a wide scale. And that needs to be incorporated into healthcare. It needs to be recognized as part of the way that food is allowed to be marketed.
Oh, this is maybe a bit of an ambitious wish list, but I would like to see a more high-profile and direct dialogue between government and consumers, taking the pulse of the nation with polls, maybe even TV debates, referenda, whatever. Just bring this issue right into the forefront and then take action accordingly.
Thank you. So I think what I've heard from our excellent panel this evening is very much that nutrition is still the responsibility of the individual. Now, the problem I see with that is that the individual is variably informed. So the people who are best informed are probably going to get the benefits, and society will get the benefits of their being informed. However, I hear no appetite for over-regulation, but rather that the consumer, the Canadian population, is made more aware through some of the approaches that Gabrielle has described, and that in fact it's public pressure, public awareness that will actually drive both the governmental position as well, to a large extent, I think, the industry, which is responding in many instances to the demand for a more healthy diet. Clearly, we have this big gap in terms of physician interest and enthusiasm with nutrition, and I'd like to see a much stronger dialogue between the dietitians and the physician community in order to ensure that that component of the team is much more effective. David?
I just wanted to make a very quick comment that just occurred to me, which is that an informed public requires that they be educated. And we allow people to learn French, English, and all sorts of other things in school. And although home ec is much derided, we actually don't teach people nutrition in school. And that's a really major basis for moving forward.
I think that is an important point, and this question of education is that it has to be the right education, because as Gabrielle has pointed out, there are people who are going to be writing about the antioxidant effects of this food or that, or the anti-inflammatory effects, when in fact there's no evidence. And we've heard several of the panelists this evening emphasizing the importance of evidence. And I think that this is something that in Canada we're increasingly aware of. In some ways, I think we lead the field, certainly in gastroenterology, in terms of evidence-based approaches. And I think in terms of our approach to nutrition, this is absolutely paramount. On that basis, I think I should wind it up for the sake of time. Thank you all for staying to the bitter end as you have done. And thank you on your behalf to our panelists who've really done a fabulous job, I think, in raising a lot of issues, not necessarily answering all of them, but giving all of us a big challenge for the future. Thank you all.
So, ladies and gentlemen, I'll just close this session. We have a short draw here for a winner, and I'll have Catherine Mulvale, who's our executive director of the CDHF, draw. Catherine, do you want to do the draw? Helen Fry, F-R-Y-E. Helen has won a year's supply of Activia. So thanks for staying, everyone. We've had a great dialogue about nutrition. I want to thank our speakers, Steve Somerton and Des Ledden, who pulled this all together, to our panel members, to Catherine Mulvale, who's the executive director of the CDHF, and to all of you to attend. Danone has been our sponsor, our exhibitors at the back. Thank you very much, and we look forward to seeing you all next year at our next annual Health Summit. Thank you very much.